Hi, my name is John Gibbons, and today we're going to do active release technique or soft tissue release for the hamstrings. When we test the hamstrings, you can simply say to your patient, lift your leg as far as you comfortably can, and if they get around 80 degrees, 90 degrees, then that's relatively normal. In this case, you'll find that the bind is well before the normal range of motion, so we can safely say that the hamstrings are relatively tight. What we're going to use in terms of a lubricant, we're going to use a wax, like a massage wax or myofascial wax, and apply this onto the hamstring area. So we don't need much, just a little bit of the semis and the bicep femoris. And I'm going to show you a few techniques. First technique, we are going to bring the leg over the shoulder, like so, with the knee in a flex position. You can activate the muscle to start with by simply pulling the heel towards your bum. So you can activate the hamstrings for 10 seconds, which then induces a relaxation period. Once we've done that for 10 seconds, what we're going to do is the patient's going to slowly straighten the leg as far as they comfortably can. And we've got the semi-tendon and the bicep femoris. Reinforce the thumb in the centre and between the two hamstrings, and then literally slowly straighten the leg. And then we can literally work through as far as they comfortably can. I can ease off, they can ease off. Find a new position and slowly straighten as we're working through. You'll find that the patient can't go too far in extension and relax due to the tightness of the hamstring. Lock in and then slowly work through. So that's working the septum between the hamstrings, and then ease off, and then you can start again. So lock in and then slowly straighten. Okay, so we can literally work in between the hamstrings like so. A nice technique is working on the semis or the bicep femoris. From this position, I'm going to slowly add in flexion on the hip with extension of the knee. Using the back of the hand, you can literally come into the semi-tendinosus and membranosus like so, and then slowly glide the hand down the hamstrings as I try to increase the flexion. Feel okay? Yeah, you'll notice that the knee is still bent, even though I'm still lengthening the hamstring, trying to encourage lengthening of the origin, like so. Okay, you come towards the ischial tuberosity. To do the bicep femoris from this angle, so the hand is going to be on the bicep femoris tendon and literally press onto the bicep, and you can literally bring the leg across the body as far as you comfortably can. It's up to you whether you want to get the patient involved a little bit, as in they can pull the leg across, or you can just do the work for them. Okay, so you can literally use your hand, working on the bicep, drifting a little bit onto the IT, into the bicep now. So the bicep femoris coming down, okay, start there, locking in, okay, and then slowly working through as we come through the centre part, alright, like so. A nice technique is, I'm going to come around this way. If you bring your leg, you come along your side towards me. Keep that bottom leg straight. So bring the top leg and rest it on your hip. Okay, we have a bit of tension already on that side. So from this position, bicep femoris. So we can use the hip. Okay, so we can flex, and then I can literally bring the leg up as far as you comfortably can. And then find the bicep femoris. Reinforce the fingers, and I can literally work through the muscle as I bring my body and lengthen through. Okay, so that's working through. Think about where we are anatomically. So the bicep femoris is going to drift this way, and then the IT band on that side. So naturally, where the vastus lateralis and the bicep femoris and the IT band, you know, there's a septum between. You can almost like separate the bicep between the lateralis, like so, and then you can literally come onto the bicep femoris as we come in through this way. You okay? A bit tightening. just show you that one again. So bring the leg back. The IT band, you can literally, because the IT band is involved in flexion of the hip, yeah, and also extension and flexion of the knee, depending on what position you were in. So I can work through the IT band to the tender there. So I can come superior of the IT, and I can come inferior of the IT band, so working inferiorly and superiorly. Okay, as I come in through that. Okay.